So we'll make a start, and I'm sure more people will join as we go. So the purpose of me doing this today is just to share some of my knowledge in diabetes. As some of you know, I've been working in diabetes for 25 years, half my life. So I have worked in a lot of different places, and again I see that the Asian community, be it Punjabis, be it, Gujaratis, wherever, we don't get as best a deal in terms of diabetes care for a number of reasons, as we should do. And I think through COVID, it's more so that our community really suffered because we just simply aren't accessing virtual clinics and what have you. So in my role, I do virtual clinics, and a lot of my patients that are in need are not able to access the services. So we're really struggling. And there's a lot of myths out there, and people get all confused and they go, "Mera blood bad, but what does that actually mean?" So hopefully through these sessions, we can address some of those. And even if, a couple of you go back out into the community and tell other people that have got diabetes what's right and what's not. So hopefully we can help people. Diabetes is a condition that doesn't have to be life-threatening. It's not the end of the world. People don't have to go blind. People don't have to have kidney disease. But sadly, just because of a lack of understanding, people do end up really bad. I don't know if any of you know anybody, but it's more prevalent in the Asian community. We see people having to have amputations because they've had years where their sugars have not been well managed. We have kidney disease, and all these things are manageable if people take the right care at the onset of when they're diagnosed with diabetes. As you probably know, we are more at risk of diabetes, Asians. I've had loads of questions, and I'm hoping to address some of those as I talk, and anything I haven't, we can address at the end. So essentially, diabetes is a condition that affects people of Asian background and Afro-Caribbean more so. We don't know why. We don't know if it's because lifestyles have changed so much. So if we go back to India now, and as people are getting more and more wealthier, we're seeing a higher prevalence of diabetes. That's because people are not eating as well as they were. They're eating more processed food, and we are seeing that they're not as active as they used to be. They're not doing as much hard work as previously. So those things are a hotbed to develop diabetes, and that's what we're seeing. So every year when we go back to Punjab, you see more and more people have got diabetes, because essentially it's down to the lifestyle for majority of cases. We'll start off with what there's two main types of diabetes. There are some others, but we don't need to worry about those for the purposes that we're talking today. And just to say, the things that I do talk about and the advice that I do give today, it's very generic. I'm not giving anybody any specific medical advice, because I don't know what other medications you're on. I don't know what other complications you have. So this is generic advice just on diabetes. If anybody wants more personalized advice, then I would have to speak to your GP and then go from there. But that's a whole different ballgame. We won't waste time going down that route today. So this is very generic. Okay. So there's two types of diabetes. There's type 1 and type 2. Majority of people will have type 2 diabetes. And if I tell you Theresa May, our previous Prime Minister, had type 1 diabetes, and you would have often seen on pictures, she has a patch on her arm, and that's a monitoring machine that monitors her blood sugar levels. So just on that note, Rav, could you get me a blood glucose machine from the kitchen, please? Okay, so now I've got this little dolly, which I think is really helpful to show people how what is diabetes and how do we get it. So I'm going to put that up there. Now, this is our internal organs. As you can see, there's the lungs and the heart, liver, and this is our stomach. So there you go. Behind the stomach, and I can't pull that out, but behind that stomach there's an organ called the pancreas, and it's like a finger size. It's probably bigger than a finger, but it's about the size of a finger. Looks like a finger. And that has lots of little cells on it called islets. And when you eat something, that pancreas releases a hormone called insulin out of those little cells as a little islets. That insulin converts the food that you're eating into energy. It should do. When we have diabetes, that pancreas, that finger-like organ that's hiding behind the stomach, that's not functioning so well. So what happens is when you eat something, your body's not able to break it down and get the energy from it. And then that energy that should be going to your muscles is then floating around your blood. And then you've got high sugar readings. That's essentially what diabetes is. So thank you. So really organized, as you can see. So that's essentially what diabetes is and why we get high blood sugars. Now, with type 2 diabetes, and remember I said this is the majority of people have type 2, what happens is that organ, the pancreas, is not working as well as it should. For whatever reason, it could be that you're overweight, you're carrying extra weight, and that's causing the pancreas not to act so well. Or it could be just genetic. It could be that you are predisposed to diabetes because you have a very strong family history. So I had a question that both parents have got diabetes. And then, the person said, am I likely to get it? I will go through the risk factors in a minute. But yes, so, the short answer is if you have a strong family history, you are predisposed, i.e. you are more likely to get it than anybody else. So coming back to our pancreas. So in type 2 diabetes, it's working. It's not working as well as it should. So, you might get the odd high sugar level, or if you eat too much, you fall asleep after you've eaten. That's, these are all signs of high sugars. That's type 2 diabetes. And there's a lot that can be done for type 2 diabetics. Type 1 diabetes, and you will see very young children with this. Type 1 diabetes is when the pancreas completely stops working. It's not releasing any insulin at all. And there isn't much you can do about that, and you would have to have insulin. So, this is when people say digilaglia or digadilagia, whatever. Type 1 diabetes, it's an autoimmune condition, and somebody could be super, super fit, and they can still have type 1 diabetes. Some famous people, Halle Berry, the actress, she's a type 1 diabetic. And as I said, Theresa May is a type 1 diabetic. And there are athletes that are type 1 diabetics, like global level performing athletes that are type 1 diabetics. So that unfortunately has to be managed with insulin because the body's not producing any insulin. So that's type 1. Type 2, we have a range of medication. We have a range of, different injectable therapies that we can give to people. Diet and lifestyle is essentially the foundation for treatment for type 2 diabetics. So, okay, so that's type 1 and type 2. Now, how do you know if you've got diabetes? Well, let's do the risk factors first. What are the risk factors? So, if you're overweight, so for Asians, some of you might be familiar with the BMI chart where we look at the height against weight. And normally we say to people, try and keep your BMI under 25. But for Asians, we say keep it near to 23, just because we are higher at risk of developing diabetes. So that's your BMI, so your height for weight, and you can go onto Google and put your height and weight in, and it would tell you. For reducing your risk, keep your BMI at 23, which is very, very slim. So there's that, and there's your waist circumference as well. You can measure your waist. If you've got extra couple of inches around your waist, try and reduce those, because it's the weight that you carry around the middle that it's increasing your risk. If you carry more of your weight on the bottom of your body, not so much of a risk, but if it's a central obesity, so around the stomach, around the waist, that's putting you at high risk. So, age is a factor. So simple wear and tear over the years, that pancreas stops working so well. So age is a factor. Ethnicity, so that's Asians. And if you're overweight, that's a factor. Some people develop diabetes if they go onto steroids for any other condition. being physically inactive. So if you're just sitting down all day, not doing any exercise, not burning off that food that you're eating, that will also lead to increasing your risk of developing diabetes. And if you've got a family history, you have a very high risk to develop diabetes. So if any of you watching have been diagnosed, your children are at an increased risk. And for women, if you get diabetes during pregnancy, so it's called gestational diabetes. If you've had diabetes through pregnancy, this places you at higher risk later in life as well to develop the diabetes. Usually pregnancy diabetes tends to go away when the baby's delivered, but then later on in life you're at high risk, so it would count as a high risk if you've had that. So the signs and symptoms. So remember what I said earlier about the body not getting the nutrition from the food that you're eating. So what happens is you get a lot of weight loss. So people will say, you know, if people haven't seen you for a while, they'll see you and you'll look very ill, you'll look very thin. And often people think, oh, great, I'm losing weight, this is really good. Actually, it's not good, because your body is breaking down its muscles to give you energy, and that's not a very good state to be in. So that's because your sugars are high, that your body's struggling to get energy. So that's not a good sign. And if you've been diagnosed with diabetes, lost a lot of weight, some of it will go back on because the body's trying to refine its balance. So weight loss is a big one. Unintended weight loss, we call it. Going to the loo a lot, so passing urine. And when you go to pass urine, it will smell like pear drops or nail varnish smell. And it will be frothy. So there'll be froth in the bowl of the toilet where you've passed urine, and that's strong. The smell is quite strong. So that's also your body is trying to get rid of the extra sugar that you're not able to use because you can't convert it into energy. Okay, so that's that one. A lot of people say the legs hurt. So often, you know, my elderly patients will say, meaning the back, the calf muscles. So people feel burning, they feel tired, they feel pain there. They feel pain on their feet, the toes. And that's also because the blood's not circulating very well. So that's the sign. Another sign is blurred vision. So blurred vision in that you can't see, or you might feel like you've got grain in your eyes, like sand. And that's basically the sugar that's building up in the back of the eye, and it's crystallizing and it's causing you to feel itchy eyes. So that's another sign to be careful of. And going to the loo a lot, like I said, getting up in the middle of the night to pass urine, just your body's trying to get rid of that extra glucose. And thirst. So I have seen people that drinking up to 6-7 liters of water or fizzy drinks because they constantly feel thirsty. They feel the dry mouth, so their mouth feels very dry. They just can't seem to be getting enough water in. So that is a sign that your body is in a bad way, and your sugar levels are high, your blood sugar levels are high. So those are the main symptoms. Often people keep getting repeat urine infections. So you might get thrush again and again, or you might get urine infections. If you do get reoccurring urine infections, you need to speak to your GP, get a test done to see if your sugar levels are running high. So they're sure signs that you've got diabetes, or your sugar levels are running higher than they should be. So that's the signs and symptoms. So when you have a blood test done, so your GP will do your blood test, they will look for your sugar readings. They will look at something called a HbA1c. Now, a HbA1c is a benchmark of how your sugars have been for the previous 3 months. If you don't have diabetes and you don't have any problems with your sugar levels, that reading will come back firmly under 42. If there is a slight issue and your sugar levels do go up at times, that will come back as being between 42 and 48. That there is called borderline diabetes or it's called non-diabetic hypoglycemia. Now, across the UK, there's a program called the National Diabetes Prevention Program, and your GP or your practice nurse, whoever's done the blood test, will then refer you into that, and they will try and give you some lifestyle diet advice to try and bring your sugar levels back down. So that is the gold standard for how your sugars have been. And what that measures is, for every red blood cell that you have, it measures how much glucose is attached to it. So each red blood cell, how many glucose or sugar molecules are attached to each of your red blood cells. That test can only be done after 3 months for a good result. There's no point really doing it any sooner. And that's your gold standard of how am I doing with my diabetes care. So in the UK, we would want it to be under 48. If you cross over from, say, 47 to 48, you will be diagnosed as having type 2 diabetes. Most of the people that I see in my clinics have a HbA1c of 100. So I see the really complex cases. But if your sugar levels have gone above 48, you will be diagnosed as having diabetes. You might not need to be on medication, you might not need to be testing, but your body is showing that it is struggling to keep your sugar levels under control. Okay, so that's the HbA1c. Now, when you get diagnosed, your GP might give you a blood sugar machine, which might look like this. There's so many different ones, but it basically looks like that. And what you do is you prick your finger with a device like this. You can't see the needle, you press the button, you have strips that go onto that, and if you want one day I can do a thing on how to do it, but you would put the strip in there, put a blob of blood, and that will tell you what your sugar levels are like there and then at that moment in time. So if I was to test my sugar now, do this now, I would expect my readings to be, I don't know, I've just eaten, so it'll probably be about 6, 7. If I was to test it again in 5 minutes, it will be different. So no diabetic will ever have the same reading consistently. So they do vary. Now, for fasting readings, we would advise that they're between 4 and 7. And after a meal, 2 hours after a meal, there's no point testing any sooner. It should always be 2 hours after you've had a meal. It can go up to 8. Well, it can go up to 10 for some people, but that target will be set for you by your practice nurse or your GP or your diabetes nurse or whoever you go to see. But it there is some variation in that. It is going to be higher 2 hours later. So if pre-meal your sugars are 6, post-meal we can expect them to go up to 8. Fine. What we don't want to see is you walking around with sugars of 14, 15, 20s, what have you, because that's when the damage is occurring to your internal organs. And I'll talk a little bit about that in a minute. So you would test your sugars, see how you get on. So normally what would happen is you would be diagnosed. Doctor may or may not give you a machine, or you can buy one yourself. But the machines are usually given out free. It's the strips that are expensive. But you get the machine, you would test your sugars, see how you're getting on, and then in 3 months' time you might have another blood test, and it's that HbA1c that they'll be looking at. And if that's still high, then they're going to need to start you on medication. And medication might be Metformin, which is a tablet that's taken with meals. All diabetic medicine should really be taken with food. Anytime you get diabetes medicine, ask, when should I be taking this? Because we see so many people that have been given diabetes medication, but they don't take it on time, or they miss days. Days and days. And then when we see them in clinic, right, we're going to have to put you on insulin because your sugars are not under control. Then they say, oh, well, actually, I haven't been taking my tablets. So it makes it really difficult. So it's advisable to take your medication as advised, so it can work, it can do what we want it to, and also with food is really important. I'm just going to see if I can get a Metformin tablet. Can you get me a Metformin and a Glic tablet, please? My helper today, Rabbi C. So I'll show you what Metformin looks like and what glycoside tablets look like. These are the two that would first start. So a Metformin tablet is the first instance that would be started. That can go up to 3 times a day. 2 tablets 3 times a day, depending on what dose and what strength you've given. A lot of people, when they first have metformin, don't get on with it because it can upset the tummy. I would say that usually happens when it's taken outside of mealtime. So take it with food always, and give it some time to work, because metformin has lots of additional benefits and it can really help prevent against heart disease and stuff. Sorry? So it's in the cupboard. I think it's on top of the fridge. Okay. So medication. So there's lots of tablets. So I'll show you metformin when he gets. Which one's this? Okay. I'll show you them together. So metformin is the first port of call for tablets. If that doesn't work, there's lots of different tablets, lots of new ones coming out all the time. You know, your doctors, your nurses will then just keep increasing your medication to try and get that HbA1c. Remember, the bottom line is always that HbA1c. What's the direction of travel for your diabetes? Have we managed it? What we don't want to see is year on year you come back and the HbA1c has gone a little bit higher, and then before you know it, you've got your complications in place, and you're really struggling to get on top of it. And unfortunately, in my opinion, and like I say, I've been working for more than 20 years, majority of Asian patients, this is what happens. They come in, they have their annual checkup, okay, a little bit higher than previously, off you go, come back following year, and then next, they're in the 80s. So HbA1c has gone up to 80, 90, right, we're going to put you on insulin. Without really having the support in the first place to see, can they make changes to their diet? Can they make changes to their lifestyle? Is there any other medication? Are they taking their medication is a biggie actually for us. Okay, I think he's struggling to find it. Leave it. All right, leave it then. But anyway, metformin is a 500 milligram tablet. It looks like paracetamol, and you would take it with food. If that doesn't work, or depending on how high your HbA1c is, you might be given a glycoside. A glycoside is a very small tablet. There we go, small, like that there. And you would take 1 or 2 of those with food. Most important, always, always, always with food. Okay, now I'm going to just go through the medications and then we'll talk a little bit about the food and what changes you can make. One thing I do want to show people is insulin. Because people fear insulin, and you don't have to fear it. Now, it's called insulin, but for some reason Asians call it insulation. So I get patients going, I don't want to have insulation. No, I'm sure you don't. But insulin comes in a pen like this. Okay, so you don't have to draw up a syringe, like an injection, like a deca, as people say. It looks like this. There'll be a pen. It's pre-filled. So the insulin is already in there. We would tell you how many units you would take, and you would draw those up using this. Now, where's my camera? So if you can see, there is the numbers. And we would say to you, right, when you eat, take 4 units, take 8 units or whatever. And you would just do that. And then there's a very, very small needle that goes on the end, and I'm going to show you that as well. So I'm just doing this just so that people are aware, because this is something that causes a lot of anxiety. So the needle in there, so you would put the needle on. Now there is a needle on there, if you can see that. So that is essentially what insulin is. So people really panic and stress about it, but that's it. And it would go into your tummy. You wouldn't, where you check your sugars with your finger, that's more painful than this. Okay, so that's what that is. So if you did have to go on to insulin, that's the worst. Okay, so at the moment, there's, as I say, lots of different medicines coming out. We have weekly injections, so you wouldn't have to have a daily injection. There's lots and lots that, and that's something that you would have to have a conversation with your healthcare professional who manages your diabetes. But our ultimate aim is to get that HbA1c under control. So somebody's asked, why have the doctors stopped giving the strips? As we all know, the NHS is struggling, and the blood sugar machine strips, so the strips that you get to test, these, the ones that you put into the machine. So the machines are really cheap and the pharmaceutical companies give those out. So these are the strips. The GPs have stopped prescribing them because, number one, not everybody needs to test. If you've got good control on oral therapy, so medications, tablets, you don't need to test that often. So you don't need to have the strips. And the strips are quite expensive. They range from £30 to £50 a month if you were to be checking every day. So that cost factor is one. And secondly, if you don't need to test, why would you unnecessarily prick your finger? So unless you're really, really wanting to, if you wanted to, there's a new freestyle. The patch that I mentioned earlier, it goes onto your arm like a smoker's patch thing. You would put that there, and with your phone, you can just scan it and it would tell you what your sugar levels are like there and then. That is about £50 every 2 weeks. If you want more information on that, I can put that up or send it to you, or just drop me a line and I'll give you more details on that. But you would have to self-fund that, and they can't stop you from self-funding it. But type 1 diabetics can have that machine free. It's called the Freestyle Libre, and that's a nice guideline in the UK for that. Okay, so that's the medication. Hopefully that answers your question. So medication can only do a certain amount. Even insulin can only do a certain amount. Ultimately, we need to reduce your risk. Now, earlier I spoke about the HbA1c, and research has shown us if your HbA1c is high, the risk of having problems related to diabetes also increases. Now, I don't want to scare you, but it's good to know what you're dealing with. If your sugars are left unchecked, so you're really running high for long periods of time, so, like I said earlier, that your sugars are in the teens, so, 14, 16s. And the thing with diabetes is people think, oh, it's all right, it's fine. My sugar's a little bit high. Don't worry about it. You might not feel that the issue's there and then, but long term, your body's getting a real thrashing. Your kidneys being the first point where you're getting the thrashing. If you've got high sugar levels, your kidneys have to filter that out. And kidneys are like a sponge. If you've got lots of sugary blood going through that, the sponges get damaged and we have kidney damage. Now, unfortunately, kidneys are such an organ that once they're damaged, they can't regenerate new cells. So if the kidneys start failing, kidney damage starts happening, it's a slippery slope and it's difficult to manage that. So to monitor your kidney function, there's something called an EGFR. EGFR, which your GP would be doing when you have your annual checkup for your diabetes. So every time they do your HbA1c, ask them to check your EGFR and ask them, say, what's my EGFR? That's a measure of what your kidneys are doing. It should be around 90. If that starts dropping, then you need to start reviewing what you're doing. Is your sugar level under control? Is your blood pressure under control? The medication that you're on, ask your GP to review your medication. So that's also really important, and that's EGFR. Okay, so that's your kidney function. That should be tested once a year. So other than that, as I mentioned earlier, the eyes. Now, our eyes have very, very fine blood vessels at the back. When our sugar levels are high, those blood vessels burst. And then you at the back of the eye, you get blind spots, or we used to call them cotton wool spots. What that is where the eye has been damaged, the blood vessels have burst, and as you get more and more of that going on in the eye, you lose vision. So, you probably have seen people that have had diabetes and have gone blind. It used to be the leading cause of blindness in the working population, diabetes. So it's something that's really important to keep on top of. And that's why diabetics have an annual eye screening checkup where they put drops in your eyes, dilate your pupils, look in the back of the eye to see if there's any early signs of any damage occurring. If there is, then that can be managed. So that's important. So eyes need to be protected. People with diabetes are at increased risk of heart disease, so coronary heart disease. So therefore, we would check your cholesterol. So your doctor, when they do your blood test, they would check your cholesterol level. Try and keep it under 4. For Asians, definitely under 4. There's evidence to show that people with diabetes have narrower blood vessels, so we must keep the blood pressure under check as well. A normal blood pressure is around 120/80. If you've got diabetes, keep your blood pressure less than 135/85. But these are targets that your practice nurse, your GP, whoever looks after you, will discuss with you individually. But blood pressure and diabetes together are not a good mix, so you need to keep on top of both of them. Okay, let's have a look. Any questions so far on here? Okay, giving strips. Okay, yeah. So type 2 won't become type 1, but type 2 might then, if the medication hasn't worked, the tablets and what have you, then they might need insulin. That doesn't make them insulin dependent, because type 1 are insulin dependent. Then they will be insulin treated type 2. Okay, so there wouldn't be a type 1. They're two different things. Okay, any more questions? Just going to have a quick look at this before we go on to some more. If A1 test going normal every time, but daily fasting sugar going high, then normal. Is there something risky? So the test, the HbA1c, is the ultimate test. So if your sugar levels are running high here and there, that's fine. But it's the HbA1c that would decide. So in clinic, it's the other way around. We get people coming in, giving us perfect sugar readings. You might have a book that looks similar to this. And what you would do, you can see that, you would check your sugars if you were checking at home, and you would write them down. So you'd be given a book by your healthcare professionals. So we get people coming in with, oh, my sugars are perfect. I wake up in the morning, they're 5s and 6, all looks good. But when we do the blood test, it tells a different story. That's telling us that their sugars are in the 20s most of the time. So that is the gold standard, really. So your HbA1c is going to tell the true story, and that's what matters. Okay, I'm just going to have a look at some more. Stevia plant good in diabetes. Stevia is excellent. It's a natural sweetener. I'll talk about fruits in a minute, Tony. Type 1 diabetes kids informations. So beyond type 1 diabetes kids, that's a whole different topic, and I'm happy to talk about that or get somebody in who specializes in pediatrics to talk about that. But basically, type 1 diabetes is when the pancreas stops working. And unfortunately, we do see very, very young children where the pancreas just stops working and they need to be on insulin. Or if you're lucky and you live in an area where they get on pump, they'll have an insulin pump. And diabetes staff will try and make it as easy to manage that. But that's a big topic in its own and would warrant more time to go through that. Reversing diabetes. Okay, so I'll talk about diet in a minute because I know a lot of you want the answers on food. But reversing diabetes. Now, if you go to my website, I've written a bit on this, remission. It's really not fair to say to somebody who has diabetes, your diabetes is cured. If you go onto the internet and put diabetes cure, you will see a mountain of information. You can't cure diabetes. That's the bottom line. You cannot cure it. And if anybody says to you, I can cure it, they're lying. They're trying to rip you off. You can put your diabetes into remission. What that basically means is that your levels are now in the normal range and your body is behaving in a normal fashion. However, to get to that point, you would have had to make lots of diet and lifestyle changes. And if you were to stop those diets and lifestyle changes and go back to how you were eating previously, or how you were physical activity levels were previously, you would then go back into being a diabetic. That's why we can't say we have cured diabetes, because there's no such thing. If your body has shown that you are behaving in a diabetic state, and if somebody was to then say to you, oh, you're all right, you don't have diabetes anymore, you go back to eating donuts and, you know, having a massive meal and sitting on the sofa all evening, your body is then behaving as a diabetic again, because your body is in that state. And some of the damage that I just spoke about with the eyes, the kidneys, you know, blood circulation problems, heart disease, those issues are then festering away. But because you think you've cured your diabetes, you know, it's really not right, people saying that they've cured diabetes. If you go to my website, along the top tab, there's a remission, type 2 diabetes and remission, and I've tried to put as much factual information in there as possible. It is very much possible to go into remission with diabetes. So again, that magic HbA1c, if your HbA1c is under 48, we will then say, okay, well, actually, you know what? You don't need to be on medication, because you, by making your lifestyle and diet changes, have brought your sugars down well enough that you no longer need medication. And actually us keeping you on medication, we're increasing your risk of you having a low blood sugars. So that's very possible. So to make diets and lifestyle changes, the main aim would be weight loss. So if you've got weight to lose, you know, even losing 10% of your body weight will give you excellent results in terms of the blood sugar levels, the HbA1c. If you've got more weight to lose, then, you know, the nearer you are to that BMI 23 that I said earlier, or your waist is near to 32 or 28 to 32, you will be improving your sugar levels a lot. And we do see people that, because they've had poor control, they've ended up having to take insulin. So they've taken the tablets, hasn't had any impact, because their diet and lifestyle needs a lot of work. Then they'll, you know, go on to insulin, and something happens to scare them, or, you know, some lifestyle change. They start exercising, they start losing weight. Then we get to a point where we have to start going backwards and saying, okay, we can stop your insulin, we can reduce your medication. And as every time we're doing the blood test, it's lower and lower, and that HbA1c has come back to normal, we will then say, okay, you are in remission, and we will just check you once a year just to make sure you stay in remission. But you will still have that you have type 2 diabetes on your record. I hope that answers that. Now, how do you get to remission? So weight loss is the key, and weight loss is difficult. It's very difficult. It's not easy to do. I've got people asking, what's the ideal weight? I would go by your waist. So if you can lose a couple of inches, for men, for Asian men, if you can keep your waist under 34, that's a good way to go. And for ladies, it's less than 32. So the waist, so that's the narrowest part of your, just under your belly button. So try and lose weight, really. If you've got extra weight to lose, you've been diagnosed, there, you know, there's lots of things you can do. Exercise is a must. So half an hour walk a day after meals is a good level of exercise. You do not have to go to the gym. If you can, that's good. If you want to do some weight training, get some body strength, you know, speak to a trainer, what have you, is good. But that's all you need. When we talk about exercise, we're not asking you to go and run a marathon, you know, cycle mountains or whatever. Half an hour walk after a meal is good. And what I advise my patients is, if once you've had something to eat, don't sit down. Just don't immediately sit down. For 10 minutes, keep active. Whether it's walking around the house, walking around the garden, going to clean the kitchen, going up and down a bit. Any activity, physical activity you do, helps burn that sugar off. So remember, we talked earlier about our little dolly man. It's the stomach, pancreas. So when you eat, the pancreas has to send out the insulin to keep the sugars under control. If type 2 diabetes, that's not happening so well. So what you're eating is then going into your blood just as sugar. You're not converting it into food as well as you should. So if you do some exercise, you're burning some of that extra sugar that's in the blood. So your sugar levels will come down. Now, the sort of food that pushes the sugars up. So there's different foods. There's carbohydrate foods, which are our starchy foods. So those are things like potatoes, rice. These are plastic, by the way. There's different sorts of carbohydrates. So you've got your pastries and things like croissants and things like that. So carbohydrate foods, roti, chapati would count in that, rice, pasta, bread. So carbohydrate, when you eat it, so it's like fuel, petrol for a car. When you eat carbohydrate, your body converts that into sugar. Glucose, sugar, whatever we call it, it is essentially sugar. So you eat it and it will convert that into glucose, and that will affect your blood sugar levels quicker than any other food. Okay, so carbohydrate is good, but the problem with our Asian diets is we eat too much in one go. And another thing that I often find is that we wait till the end of the day to have our main meal, when actually it's better to eat lighter in the evening and have a proper lunch if you can. So I have seen people that will have rice, roti, and maybe potatoes in one meal. That is overload of carbs, and that is all going to be converted into sugar in the body. So that's not a healthy way to eat. It's better to eat 3 times a day, smaller meals, equal portions, and restrict the carbohydrates, so the starchy food, cooked to the amount of your fist. So if you were having a jacket potato, for instance, 1 jacket potato, that would be your carbohydrate. You would not want to have bread with it. You would not want to have potato salad with it, or pasta or anything like that, because that's carbs on top of carbs. So that's going to push your sugar levels up too much. Similarly, rice, roti, one or the other. Do not have both together. And that is, as a portion of rice, would be too much. I would say half of that. So a half of that would be a portion on a plate. So if you think of a dinner plate, a quarter should be carbs, no more than that. And the sort of carbohydrates, so wholemeal bread is not actually much better than white bread. It's just unbleached flour. Food that is raw and it still looks like to its natural source as possible is better. So if you think of bread that has got grains and seeds in it, it will take your stomach longer to break that down and get at the sugar in there. Whereas white bread, brown bread, it breaks up very quickly, and the glucose, the carbohydrate, the starch or the sugar, whatever we call it, is going to be released a lot quicker, and it's going to be like an injection of sugar into your blood. So your carbohydrates should be as high in fiber as possible and near to their natural source as possible. There's something called the Glycemic Index, GI for short, and I think I've got something on my website about this, but if you Google GI, University of Sydney, you can put foods in there and it will tell you what the GI value of it is. A really simple way that I explain this to people is, if you were to put that food in water, how quickly would it swell up and break up? So if you think about white bread or brown bread, if you put it in some water, how quickly would it swell up? It would lose its structure quite quickly. And that's what's going to happen when you eat it. So the starch in that is going to be released into your blood quickly. Whereas if you have seeded bread, or like flat bread, so like pita bread, for instance, or wraps, if you put them in water, they will hold their structure for longer and they're not going to be broken down so quickly. So your sugar levels won't go up sky high quickly. They'll slowly go up. So carbohydrate is not a no-no, but our portions have to be controlled. The portions are the problem with us. The Asian diet, the Punjabi diet especially, is actually quite healthy if you think about it. Where we go wrong is the portions. We have, 2 rotiyan. I know people that can eat 6 rotiyan in one go. That's a lot of starch to have in your diet in one go. Now, this book, I've got my name on there, but it's called Carbs and Cows. This is quite an old one, but they have a website, and on my website I've got the link. There's free stuff on there that you can have, and this tells you, I'm just going to try and show you, this tells you how much carbohydrate is in certain foods. And if you wanted to lose weight, something like this would be really good at helping you. And there's a World Foods one that's just come out. A friend of mine has written this. And this is all through the website. You can get it. And they're not very expensive, these books. So you can go into... right, chicken curry and rice. So here, it gives you a visual of what does your plate look like and how much carbohydrate is in there. Oh dear, get it all wrong. There. Okay. So it gives you lots of different meals. It gives you for roti, for different foods, how much carbohydrate is in a meal. Now, if you wanted to do a low carb diet, which has been shown to have some really good results, I would limit your carbohydrate to about, I'm hesitant to say because it depends on your activities, but about 20 to 30 grams per meal 3 times a day. So one slice of bread, a normal medium slice of bread, has 15 grams of carbs. A chapati, roti, depending on its size, will have up to 60 grams of carbs in it. So unless you can make very small, thin rotis, think about how much carbs. And this book has some really good visuals. If you go on their website, carbsandcow.com, the link is on my website as well, and under further links, there's some free resources on there which you might find useful. But just by looking at your food, you can estimate how much carb is in there. So if you have too much carb, you've got too much fuel on board and you're not burning it. So I have to say, with my patients, my Asian patients who have struggled with their diabetes control for years, immediately when we've looked at the carb content in their diet and we've reduced it, we're getting some fantastic results. And people are able to reduce their medications if they reduce the amount of carb load that they're having per meal. So someone's written Carbs and Cow is great. Yep, it's a fantastic book.
What food can be used to supplement sugar?
So sugar is not really required in the diet. You will get the sugar that you need from the carbs. So, if you're having roti, sweetener, you mean?
Do you recommend Atkins diet?
No to the Atkins diet. No to keto diet. The reason being, our body needs all the different nutrients which come from the different foods. Dr. Atkins, when he died, his heart was so enlarged. So anything that tells you to get rid of carbs, like eliminate carbohydrate from your diet completely, it's forcing your body to break down its fat and muscle for energy, because you need energy. You need a certain amount of glucose in your blood. That's energy. That's like petrol in a car. You need that. When you start cutting your diet out completely of carbs, you stop having carbs, you're not giving your body the fuel that it wants to function. And one of those functions is our brain function as well, right? So when you cut out carbs completely, your body is then going to its fat and muscles, breaks those down to keep the sugar levels at a healthy level. Your heart is also a muscle. You do not want to be in a ketotic state where you are burning your muscle. That's dangerous. I hope that makes sense. So that's why any diet that is completely carb free is not recommended, especially if you've got type 2 diabetes, or definitely not for type 1, but for type 2 diabetes, because if you're on medication that's working at keeping your sugar levels under control and you're cutting out carbs, it's a really dangerous thing to do. So don't do that. Definitely reduce the carbs. So try a low carb diet. Diabetes UK have a 7-day low carb plan. There is a link to it. If you can't find it, there is a link on my website. But try and limit the amount of carbohydrate you're having per meal. I would say 1 roti is enough for most people. Think about what you're having, and on your plate, think, right, what's my source of carbohydrate in this plate? And then look at it and just try and reduce it. Just looking at some of your questions there. Blood sugar diet, not really advisable, just healthy, normal, balanced diet. These diets that come and go, they're not really balanced, and so often we see more problems associated with them. So anything that tells you to completely cut out carbs, I'd avoid that. Tony, what causes cramp? Okay, that could be a deficiency in anything. It might be worth getting a test done. What foods can be used as a supplement for sugar? So for sugar, dried fruit is good. If you're somebody that really likes to have something sweet, maybe after a meal, a bit of peanut butter is a good way to satisfy that craving. Or dried fruit is fine. Yogurts, diet yogurts are fine. With yogurts, you have to be careful. A lot of foods that are advertised as being low in sugar are often higher in fat, and vice versa. So if you're buying yogurts, if it says low fat, it might actually be high in sugar. So the ones that I know are okay are Shape, Ski, Muller Lite, Weight Watchers yogurts are fine. Just be careful. When a really good way of looking at food labels is on the back of a packet, and I don't have a packet here, but on the back of a packet, anything with an OSE on the end, so fructose, sucrose, maltose, glucose, these are all forms of sugar. And by law, manufacturers have to list the greatest ingredient first. So if anything with an OSE appears in the first 4 or 5 ingredients in a list of ingredients, that's a high sugar food. So yogurts are fine as long as they don't have, fructose, maltose and all that on them. So they'll be fine as a sweet food. Sweeteners, so somebody asked earlier about stevia. Stevia is perfectly fine. It's natural. It comes from Brazil. It's an aloe vera plant. It's absolutely natural. It's quite dear. It's quite expensive. The key is to use a little bit of it because it is very, very sweet, but you can use that like normal sugar and it will not impact your sugar levels. Type 2 diabetes, blood pressure, 135 over 90, a little bit high, that blood pressure. Weight 96, taking medical last year. Cholesterol and blood pressure medicine started this month due to job circumstances, but following diet restrictions. So if your weight's 96, I would try and get a bit of weight down, and that blood pressure needs to improve. It might be worth you trying to see if you can fit into a walk, run and breathe into your day to try and reduce some of those parameters there. My daughter's sugar 200, 250 more times. What can we do, ma'am? Right, so that reading, that 200 and 250 is an international reading. So for those that use milligram blood measure, it should be between 100 and 110. So that's very high that yours is 200 and 250. You might need to get a review done and maybe look at the medication that you're on if you're not. And it says your daughter, so I'm assuming she's young. Have a look at that.
What's your thoughts on fasting for type 2?
Why doctors prescribe metformin for PCOS? Bubman, good question. So PCOS is polycystic ovary syndrome. And the last time I looked at the figures, 1 in 3 Asian girls are affected by this. And it's a hormone imbalance, and it causes cysts on the ovaries. And that causes an increase of testosterone hormone, and that can lead to all sorts of like extra hair growth, weight gain, and problems in fertility. So that really should be treated in young girls. And and it's closely linked with diabetes. So people that have PCOS are higher at risk of developing type 2 diabetes. And the reason why doctors give the metformin is really to help with the sugar cravings, because people with PCOS do struggle. And also it's been shown to help shrink the cysts that are on the ovaries, and where people are trying to conceive and they can't because they've got PCOS, it's been shown to help. So that's why, and it can aid weight loss as well. So where they don't have the sugar cravings, they can lose weight with that. Let's have a look. Biantia, I mean, your daughter is on an insulin regime with Lantus. You really need more advice. It's not something that I think we should talk about on air like this. So maybe you need to speak to somebody who can, a pediatric diabetes specialist would be the best person to help with that, because you're on a basal bolus insulin regime, and it will need more personalized care for that. I reversed my type 2, then it came back because I took my eye off my diet. So Rupinder here, perfect example. So this is why we don't say you've reversed diabetes, you can go into remission. Okay, how are we doing for time? Oh, okay, I think we're going to have to do another session. Okay. Yeah, so Samit said Carbs and Cows app is available. I would go and have a look at the free stuff first on that, the links on my website, or you can just go to carbsandcows.com and you might find that useful. So Carbs and Cows was the visual for portion control of your diet. So, I mean, there's so much more with the diet that we need to talk about, and I haven't talked about it, and I think an hour is a long time to talk and people are probably losing concentration. So we can do another session and I can go more into diet. But basically, if between now and say our next session, if you just look at your carbohydrates, they're not evil, they're not bad, but we do all tend to eat too much. We really do. And some of it goes back to a few years ago when about a decade ago, the public health advice was to have cereal for breakfast and, bread at lunch, and then lots of potatoes in the evening, or pasta and rice in the evening, which is fine. But we're not as active as we used to be, and most people can't burn that off. So when you are having roti, potatoes, rice, they're your carbs, bread. Just think, how much am I having? And what am I actually doing today? Am I going to be sitting down all day? Am I going to be able to burn this food off? Don't cut it out, because if you cut out carbs completely or you don't have them regularly, that can also impact your sugar levels in a negative way. And I'll talk more about that next time. But if regular meals with small amount of carbohydrates, so that fist size, are really important to stabilize your sugar levels. If you have a large breakfast, don't eat anything through the day, and then have a meal in the evening, your sugar levels are going to be high. And often I try to explain to my patients that not eating will actually cause your sugar levels to be high as well. By not eating, you're not helping yourself. So people think, I haven't eaten anything, my sugars are still high. They're high because you haven't eaten anything, because your body is having to compensate for the fact that you're not eating. You're not giving yourself fuel. Your liver is having to make glucose to give you the sugar to keep functioning, to keep going. Is Rogan flour good for any flour that's high in fiber is good. Now, with Asians, one thing I do advise, and it works well, is when you have roti, put different flours in. So you can get these 7-grain flours, or you can just add besan into the roti when you do the atta. That increases the protein, and it will actually lower the carbohydrate load of your roti. So try and do that. Okay, we are heading out of time now. I will do another session. If you message me and let me know, I'm happy to do some more sessions if it helps. So if today's been helpful, do let me know, and then I'll do more. This is the first time I've done it, and this is the first time anybody's done this, so it's all new. Apple cider vinegar, not enough evidence. I wouldn't say don't have it, but there isn't enough evidence for me to sit here and say, oh yeah, that's really good. I did in my promos for this, I did talk about having gorille and bindia and things like that, the disi remedies. We can do a whole session on those. What I am going to say with those is I do see it benefits people. Absolutely see like people start incorporating grilli into their diet. However, if you sit down and have 6 aloo roti and then have grilli with them, it's not going to cancel it out. But where people have started making lifestyle diet changes and then maybe introduced grilli into their the grilla juice into their diet, or started having those traditional remedies, I have seen it help. I have seen it impact. But what we would say is do not stop your medication. Grilli, bindia, cinnamon, all these things, they are not going to take the place of your diabetes medication. Do not stop taking your diabetes medication. I'm going to do one more, then I'll visit the questions, and then I think we need to call it a day because I'm melting here. Jag, your HbA1c of 47 will put you in the impaired glucose, so you need to make some changes, otherwise your next blood test could be 48 and then you will be a diabetic. So you're on the borderline, which is what we shouldn't really say borderline, we should just say impaired glucose, but you are very, very high risk of going into diabetes. Tony, alcohol, yes, I do need to speak about alcohol. So I'm going to just talk about it quickly because I don't want to leave it hanging, but we can talk more about this. So alcohol, it is made with sugar. However, it will not have an immediate impact on your blood sugar levels. Alcohol can actually bring the sugar levels down. So if you've had a drink now, if you were to test your sugars later, they will not be high, and it might be that they're not high tomorrow. The reason for that is alcohol blocks the liver from doing its normal job. So part of the liver's normal job is to just send a steady stream of glucose out into the blood just to keep your energy levels stable. When you have alcohol, that function stops. So the sugar levels actually lower. So people that are on insulin, often we say to them, if you're having an alcoholic drink, you need to have less insulin. But up to 48 hours later, depending on how long it takes your liver to recover from the alcohol, your sugars will bounce up. Now, we don't say don't have alcohol, have it within your recommendations, 14 units a week for men and women, and a unit is half a pint or 25 mils of spirits. With food is really important, not without food. So that's fine. And, just again, with your medication, if you've been told not to drink alcohol, don't drink it. But don't go for the low sugar beers. They have more alcohol in, and the impact on your liver is greater. So nothing wrong with having an alcoholic drink as long as it's within the recommendations. Okay, so I'm getting some good feedback. Oh, but high in carbs. Okay, alcohol free, but high in carbs. Normal beers are fine. Normal beers, normal spirits, all fine. Mixers, always have diet mixers, but not, we're not going to say don't have alcohol. We don't want people, you've got to have a quality of life. You can't have perfect sugars. There's no point having a perfect sugar profile and being miserable. So, okay, I'm just going to have a quick scan. Good. Okay. Wholemeal flour, not as great as whole grain flour. So add bits to it to make it whole grain. Can you add the links to your next session on Twitter? Okay. Okay, good. So I'm just going to quickly whiz through some of the questions that I had just to make sure, because I know people have been waiting, and then we'll call it a day. Rice and roti, we've talked about that. Dawn phenomena. Now, dawn phenomena is when the sugar levels are high in the morning. Now, that almost, again, it needs more time on it. We can talk about it next time. But it's when people go to bed and the morning sugars are high. And that can happen for a number of reasons. You have to actually work out if it is the dawn phenomena. So the dawn phenomena is in the morning, about 2-3 o'clock in the morning. All of us, whether we're diabetic or not, we have a surge of hormones to get us ready for the day ahead, to get us to wake up. So that's why it's called the dawn phenomenon. And what happens due to the hormones that are released, our sugar levels will also go up to get you up and ready. So that's called the dawn phenomena. And people with diabetes do tend to struggle with that. So if it is genuine dawn phenomena, then you need to manage your insulin accordingly. It might be that you don't have a carb snack before you go to bed to help the morning sugars, or it might be something called rebound hyperglycemia. So it might be that during the night your sugar levels are dipping, and in the morning when you wake up you've got that rebound where your body's trying to deal with low sugar levels. So that can be it, but that has to have a bit of work around it to eliminate that. HbA1c, I think we've covered that one. My diet is very much basic, no junk food. I am always away from fried food. I am quite active, 3 times walk, average a day. I'm 67, 60. Still, I am on borderline for diabetic. Look forward. So that's Sashi. I don't know if Sashi's on, but I think you could try a low carb diet to see if the carb load reducing that helps you. Diagnosed with diabetes, levels 116, 120. Yes. Harmanjeet Singh, you can. Your sugar levels need to be less than 110. You're 116. So these are international units for those that are from England. So you can treat it. Absolutely treat it. You can lose some weight. You can increase your activity. Start burning off some of that glucose. Diabetes is a disease or a lifestyle problem. Diabetes is a long-term health condition which can be managed with lifestyle changes, I would say. Metformin, if metformin is safe. Metformin is safe and it has lots of other benefits to be had. However, if you've got poor kidney function or your kidney function is deteriorating, then your healthcare professional will stop that to protect your kidneys from further damage. But there's no evidence to say that the metformin itself is causing that. It's more to do with the clearance of it. Okay, so this is another question on PCOS, which I have answered. And once you get diabetes, can it be reversed? Hopefully I've answered that. I'm having strange issue. Whenever I take sugar, my skin starts having rashes. I am not just because of diabetes. Okay, so if your sugar levels are high, lots of problems can happen and we don't actually know exactly everything. So there might be things that happen to you that might not be documented, but high sugar levels cause lots of problems. We talked about the eyes, talked about the kidneys, skin rashes and things can happen as well. So quite possibly, if you know that you have high sugar and every time you eat sugar, your skin rashes come, I would suggest you don't have the sugar. I would like to know if there are any long-term side effects of insulin. Also, how does stress relate to high blood sugar levels? I'll answer that in short, but stress can cause all sorts of problems because stress releases lots of hormones and they can cause the sugars to go up and often down as well, depending on the individual. And long-term effects of insulin. So unfortunately, with insulin, it can lead to weight gain. So when people are on insulin and they're having injections to get their sugar level under control, what the insulin is essentially doing is that extra sugar from your blood is converting it into fat. So you get weight gain. And that's the problem. We talked about the health issues. First signs and changes in your health. My father, 76 years of age, is going through medications related to blood clots, heart and brain. Always sugar raised. Okay, so this is a complex case, but if you've got a history of blood clots, you're on medication for that, and your sugars and blood pressure are high, you need to get the blood sugar and blood pressure under control, whatever it takes. So whether it takes medication. Okay, 75-year-old, predominantly Indian diet, what would be a replacement for chapatis? I would say you don't need to replace them, just make them thinner and smaller. No need to change them and have less, I think, really. Try and have more dal, more yogurt, more salads. Okay. Pre-diabetic, we've talked about. My dad is on tablets and my mum is on injections. So hopefully that's been helpful. I would very, very much welcome feedback. You can message me if you know my phone number, or just through the website. And there is so much more to cover, and I'm happy to do that if it helps people. I know that there isn't anything out there really, and I'm wanting to do one in Punjabi, and that would have to be earlier so we can catch people from maybe Punjab and it will help them. So yeah, so I'll look forward to your messages, and possibly I might do one on next Wednesday then, just because there is so much stuff that we haven't covered here, and hopefully we can impart some more knowledge. Thank you for joining. An hour is a long session, but yeah, okay, bye.